Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Have you or a family member ever been in this situation where you go to the doctor because something's bothering you and they just cannot figure out what's wrong? And they tell you, I'm sorry, but there's nothing we can do. Well, that's exactly what happened to our next guest. But his story is really fascinating, and there's lessons to be learned for all of us. So our next guest just happens to be my husband, Dr. Craig Bissinger. And Craig is an OBGYN in New Jersey, and he also is an author. He's written several books, one being Pickles and Ice Cream, A Father's Guide to Pregnancy. But today we're going to delve into his story, and his story with an autoimmune condition. And I just feel that because osteoporosis, a lot of people don't realize that autoimmunity can be a problem with osteoporosis and really be a cause of bone loss. So this really has implications for our bones, for every part of our body. And anyone that has been in that situation where they just can't find the answers in traditional medical care. So stay tuned. Welcome, Craig, or as your patients know you as Dr. B. I am so excited to have you on the podcast today because your story there's just so many lessons that can be learned, and I'm just excited to share it with the audience. So why don't you get started and just go over your story a little bit.
Thank you, Margie, for giving me an opportunity to share a story that may not be the happiest point of my life, but certainly one that will hopefully illuminate some challenges that as a person and as a physician that we all may face someday. And the story starts about 5.5 years ago when I was working at maternity unit in my local hospital as an obstetrician. They were doing a construction project and the physicians had been placed in harm's way, so to speak, with just a small plastic sheet between us and where the workers were. And as a consequence, I ended up getting a reactive airway kind of a infection in my lungs, which I'd had numerous times before, kind of a weakness in me and the rest of my family. It didn't just stay just a little thing. It started to escalate, and I started having a bad cough, and I eventually went to a pulmonary specialist for testing. They put me on antibiotics 3 times. Each time it didn't work, and each time I progressively was getting sicker. I was coughing, I could barely talk. It was even hard for me to talk to my patients. It was very frustrating, and it just didn't let go. And it seemed to just change and morph and get worse over the course of months. The cough stayed, it lingered, but then I started having other symptoms occur. I started getting sweats at night. Not the sweats, drenching sweats. It made me think about my patients who were having hot flashes and sweats at night. I think I was killing them here because I was sweating like terribly. I was sweating through 4 shirts a night. It was like horrible drenching. And I started having fever. Fever is what they call of unknown significance. And that's when I started to pursue more definitive evaluations with physicians.
And one more symptom you left out, you were losing weight.
Well, that was happening as well as the coughing. And so as a consequence, I was sleeping a lot. I was fatigued. As an obstetrician, it's not good to be fatigued because you're up at nights. And as this went on, I'd go to work and I'd work. I'd come home, I'd eat dinner, I'd go to sleep around 8 o'clock. I'd get up at 6:30 in the morning and do it all over again for a long time. And I didn't realize I was progressively getting weaker, and just people around me were worried about me. Everybody thought I had a serious illness. So I did go to doctors. I started with an infectious disease specialist because I had fevers up to 102 at night, which were associated with my drenching sweats. And they did an extensive workup, lots and lots of blood. lots of strange tests, but I didn't have Rocky Mountain spotted fever. I didn't have Lyme's and a whole lot of other tests that would bore you. But I can tell you that none of the tests showed anything other than I had inflammation. They did about 3 or 4 tests that were all consistent with inflammatory conditions, but they had no idea what was going on and why this was happening. It was very frustrating. I'm a physician. I know a lot about what's going on, and I knew that this was not a good thing, and I was worried. I ended up going to see other doctors because the first you don't see, you keep try again. And I went to a cardiologist to check on my heart. They did a test of my heart, echocardiogram, and they found that was healthy. I went to see a gastroenterologist because of worries about my intestines, although I didn't have a problem, but I didn't know why I was getting weaker. And I also turned out I was anemic. My hemoglobin, which is normally 12, went down to about 8.5. So this was not just an ordinary problem. This was something that was ravaging my body. And as Margie pointed out, I lost weight. I lost 17 pounds in 4 months. And I normally weigh 160 pounds. I weighed down 143 pounds. I looked like a starving wolf. It wasn't that funny.
It
wasn't
wasn't funny.
I went to a rheumatologist who I'd sent patients to for years, a smart guy. When I went into his office, started telling him my story, in about 3 to 5 minutes, he said, "Oh, you better go to New York City because I don't know what's going on with you." He already threw his hands up already, really not willing to even listen carefully to what was going on, which distressed me and frustrated me as well. And lastly, I went to a hematologist because I was anemic. And honestly, they were worried that I had some kind of a cancer. Um, and throughout all this, I still had the cough and nothing was getting better. And it looked very grim. I was very worried. I was very sick. And I had nowhere to go. All the doctors who I knew, these are people I'd known for years, nice people, smart doctors, just didn't know where to turn and they didn't have guidance for me. And I was in a bad way.
And so then when the last doctor said, "No, I'm just sorry, there's nothing we can do." That was the last words of the last doctor. And it's very fragmented because one sent to the other because each person had their little area that they dealt with. So at that point, I looked at Craig and I said, "You know what? Look, no one is willing to help you, but I'm willing to help you. But you have to completely listen to everything I say." You know, as an integrative health coach, I had a different perspective on this. But out of really just desperation, he said yes. So here was the plan. So I said, first of all, there was some blood that was at a lab. They had extra blood, and I wanted him to get gluten tested to make sure he didn't have any issues with gluten. And I think you had celiac already tested. I think one of the doctors tested for celiac and celiac was negative. And so often they say, okay, so that's not a problem. But we actually went further and had the gluten antibodies tested. So that was step one. And I guess we'll tell them what happened. So at that point, that was positive for one of the antibodies, IgG. The other two were negative, but the IgG was positive. So we knew there was a gluten issue. And his body was attacking the gluten. So the plan was to, number one, completely go 100% gluten-free. It can't just be a little gluten-free. It had to be 100% gluten-free. I was going to cook all the food. I was completely in charge of the food for a couple months, I guess. He was to eat nothing except what I approved or made. And then we also did energy work. And I know Jinsun Jitsu and some other energy treatments. So we had daily energy, daily meditation, and then major supplements as well to really supplement his nutrition. And what happened?
In the next 6 weeks, my symptoms slowly started to go away. The temperatures, which had been up to 102, went down to around 99. My sweats that maybe changed my sheets in my bed up to 4 times a night was down to once a night. My anemia, which had gone down as low as a low 8.5, was creeping back up. The hematologist decided not to do a bone marrow biopsy because he saw my levels were getting better. He didn't know why. He didn't care. And truthfully, neither did I. I should mention along the way, I had a lot of radiation. I had CAT scans and gallium scans and ultrasounds and you name it, even an endoscopy down my throat to look in my esophagus and down into my small bowel. All these things had been done and no one had known anything. And so I was getting better and they left me alone. But the story really didn't end yet.
But maybe let's explain what we thought it was, just so people understand. So what I think happened is that Craig was on multiple doses of antibiotics, and what that can cause is something called leaky gut, where you're supposed to have in the lining of the gut, there's not supposed to be any disruption. What happens is the openings become larger and become permeable. So things that aren't supposed to come in now. And so when the gluten came in, the body sometimes it's called molecular mimicry. And I think originally you probably had a virus from being in labor and delivery, and that's what caused the initial problem. But then when the gluten came in, the body thought that was the virus, had developed antibodies, and the body attacked itself. And that's what happens with autoimmune conditions. And just to tie it back to bones for a minute, this can happen to your bones. For Craig, it was his chest, his coughing. No, he had absolutely no symptoms in his stomach whatsoever, no GI issues, but it can be your weakest link. So oftentimes for the bones, you can have an autoimmune attack and lose bone because of inflammation and autoimmunity. So that's why this is so very important for so many people. But anyway, so I guess we can go back to the story. So at this point, we sort of figured out what it was. He was getting better. And the doctors, I guess at this point, said, "Oh, I guess it was."
No, they just left me alone. And truthfully, I did go to a functional medicine physician just because we felt that we needed somebody maybe who could help us move forward. And we did see a functional medicine physician who was helpful. He understood what was going on. But I think at the same time, when I dumped about a pile of about 80 x-rays and tests on his doorstep, I think he was a little bit taken back as well. But the important thing was I was getting better. And this continued. And in about 6 months into this process of healing, my weight was almost back to normal.
And you felt fine.
I felt fine,
totally fine.
and I was doing well until somebody slipped in some gluten into some of my food.
Well, they didn't slip it in.
Well, it was not supposed to have any breading on it, and I had a little piece of chicken, and all of a sudden I looked at it, and I started detecting there was some gluten in it, and I got sick for a month.
I think it was almost 2 months.
1 to 2 months.
Yeah.
Well, it happened a second time too with the pasta, where I didn't realize that when you order gluten-free pasta, that they put it in hot water that had been used prior for regular pasta. And both times I got sick. The temperatures came back, the sweats came back, the cough started up, but it ended pretty quick. But also because Margie had kind of discovered by studying that there were some other ways you could combat some of the effects of exposures to unknown gluten.
Well, the interesting thing is, I think that was when you really realized it really truly was. I don't know if you really believed it was gluten either.
Well, I didn't eat bakery goods, and I couldn't cook. I used to cook cookies for the labor and delivery staff all the time, and now I was banned.
But regardless, once it came back from the gluten, it was sort of reconfirmed that your body's attacking when you have gluten. And you have to have 100%. That's what a lot of people don't realize. They think, oh, I'll cut back on the gluten. But if you really do have antibodies to gluten, you really need to be 100% gluten-free. But the good news is there's Dr. Tom O'Brien, who's a real gluten expert. And I've known Dr. Tom, and so I had asked him, I said, is there any antidote or anything you've discovered that can help if you are inadvertently exposed to gluten? And he had, well, first of all, prior to that, he does have a pill that blocks 98% of the gluten. And so we use that on a regular basis when we go out to eat. It used to be called Glutenza, but now it's called E3 Complete or something. I'll put links to these because they're so helpful. But Dr. Tom told me very high dose vitamin. I couldn't believe there's an antidote for this, but he said, yes, very high dose vitamin D. And it was 50,000. Vitamin D, if you have the exposure, And then also he had a certain powder.
Well, it's called placenta.
Yeah,
I mean, I'm
no,
an
it's not
obstetrician.
placenta. It wasn't
It wasn't
placenta.
placental extract?
No. It was oh no, I can't think of the name of it. It's
I'll go get it.
yeah, no, that's okay.
Oh,
Don't
I
go
can
get
go.
it.
It's right
No,
over
no.
here. Yeah. She's like, you're already home anyway.
Well, anyway, so watch out. We have well, this one's called GS Immuno Restore Powder. But it's not placenta. What is it
Well, it
called?
used to be called placental extract. Yeah. Because I first got it, I started laughing, and it was an irony that I'm an obstetrician that had some kind of placental thing on it. Oh, it's bovine colostrum.
Oh, colostrum, that's the word.
Colostrum is similar to my mind, that kind of stuff. Sorry, everybody.
Anyway, so the colostrum. And then the third thing you didn't take, which was naltrexone, low-dose naltrexone. But as it turns out, this absolutely worked. Because there was another time where you had an exposure. We brought this with us. We were away, and you didn't have any issues. So.
Right, which also brought up the point of how you cannot trust anyone with gluten issues, because my sister had invited us to her home and had been very proud that she had gotten some gluten-free products, baked products for me. And so I asked her about it, and she said, oh yes, this is fine. The woman who gave it to me is gluten-free herself, and she assured her that it was perfect. Except after I had taken a couple of little teeny slices, I was so nervous. My expert Margie came in, and we looked up the ingredients and found out.
Well, I saw you eating carrot cake, and I thought,
yeah, it was good too.
Is that gluten-free? And oh, sure. But then it was made with spelt. I said, wait, spelt? That's not gluten-free. Anyway, but I had the I had the colostrum with us. I had the D with us. And so nothing happened. So it was amazing, actually. So Dr. Tom O'Brien, you are the best, because it was so very helpful. But I'll put links for these as well. But anyway, the whole point is that here, I think there's many lessons to be learned from this.
Well, let me go back, because the story has a little bit more to conclusion, and I think this is actually important. So we also have other family members who are physicians, and we were around some family members for a graduation, and I guess I was having a little bit of a relapse with my coughing, and my brother-in-law insisted that I get a reevaluation, because he was troubled that I never had come up with a medical diagnosis. And so if you remember, I went to the top doctors at a New York City hospital, and infectious disease, again, I saw 3 infectious disease doctors. I went back to the pulmonologist in charge at the hospital, and I had radiology again, PET scans and crazy tests, and a bone marrow biopsy this time as well, which all came back again without any diagnosis. And finally, a rheumatologist who looked at everything, and at the end of that conversation, he shrugged his shoulders and said, I guess your wife was right. It's gluten. And after $25,000 here, and honestly, I told her this during the course of this event, and it was as serious as that. If she hadn't stepped in, I probably would have died. And I've told her that before. And it kind of is sad to think that despite everything you do and trying to be healthy and take care of yourself, sometimes traditional medicine lets you down. And it's not because they try, it's just because what we know is not everything. So I just thought that's really one of the reasons I wanted to come on and talk about this, to make people aware of some of these issues.
And I think there's so many lessons. And I think the number one lesson is, whenever a doctor says to you, I'm sorry, there's nothing you can do, dig deeper, see someone else, find out what the root cause. Don't just accept that, because traditional medicine looks at things a little bit differently.
Right.
And so I think that's really very important, that you can't just, I mean, as you need to dig deeper and find the root cause, because oftentimes we just mask symptoms and we don't really delve into what the root cause is. And we really needed to see what was going on with you for you to get better if we hadn't discovered the gluten. So that's number one. I think that, and I think that's changed how I look at things in terms of that it's just essential to get to the root cause. So often with osteoporosis, people are just put on medication and, or even so many things, but put on medication where there may be another issue underlying it. And the gluten really can be a problem with osteoporosis. There's several people who I know, but one in particular, a woman had osteoporosis and bad arthritis. And she just decided, a friend of hers went gluten-free, and she was on Fosamax, did not help, and decided that she was going to go gluten-free. And what happened? Her arthritis, completely got rid of her arthritis. Her joints were fine afterwards, and her bone density significantly improved. So there's a big correlation, and it's something that for people who have osteoporosis, they're 17% more likely to have celiac disease. And so now it's recommended that anyone with osteoporosis get tested for celiac. But celiac is a small percent of the population. For celiac, there's these villi, or these like finger-like projections in the small intestine, and they have to be completely flattened. So completely, it can't just be partially for the celiac to be positive, that test.
So you're actually biopsying the small bowel, and that has to have a very specific appearance to be called celiac disease.
Right. So many people will say, oh, I don't have a gluten issue because they tested me for celiac. But you need to go beyond that, because you can have what's called non-celiac gluten sensitivity. And as I said, it doesn't have to be, you don't have to have any symptoms in your stomach. It could be.
Right.
So it's just something to know about in terms of the testing. There's antibody testing, both Quest and LabCorp have that. I'll put in the show notes some of the testing that you can do with Sumer. But I think it's something that people are aware of, that autoimmune conditions can cause bone loss. And there's even a whole field now called osteoimmunology, because they see that there's such a connection between bones and autoimmunity. So that's why I think this story is important. And autoimmunity, when the body's attacking itself, can be a reason for bone loss. But let's even go beyond that. So now that you've figured out for yourself what happened with gluten, let's take it the next step, what you've done with your patients. And why don't you share that, because that's really interesting.
Well, a couple of things. The first thing which is fascinating is that our local fertility center mandates that all their patients going through in vitro go gluten-free throughout the time of their attempts to get pregnant with IVF. That's a pretty profound statement from people who are very interested in successes. But as far as for me and my patients, I sit there and I'm always talking to my patients on my annual visits or even problem visits. And once in a while you hear a story. It sounds very familiar to my story. I've got a problem. I've got joint problems. I've got skin problems. My hair is falling out. I'm weak. I'm tired. I've gone to all these different doctors and nobody knows what's going on. It just kind of throws me back to what happened to me. And as a consequence, I sit there and I share my story, because I want to give them an understanding that they're not alone, that there's a lot that they can still do, and they have to be open to maybe going outside of the traditional medical practice if necessary to find answers. Because I know for myself, I had a lot of doubts. I was quite resistant to accepting that my medical school training and my residencies and the years of study didn't have all the answers. And I think that's a problem with us at times. We really have a very distinctive box of knowledge that we work within. And sometimes it's hard for us to accept that we can't come up with an answer. And one of the physicians I saw during my quest was a very distinguished infectious disease doctor at a hospital, probably one of the best in the city. And then I asked him, does he think this could be a gluten allergy? And he looked at me very calmly and said, I have no idea what you're talking about. So I think that serves an important point for you as individuals as you listen to this. You may know somebody, or you may yourself sometimes be having a problem that stumps you or stumps your doctors. And it's okay to ask for another opinions or search. And so I encourage my patients to search. I asked them to go online and read actually Tom O'Brien's information on autoimmunity, not because I'm plugging it, but because he's a very good handle on the diffuse nature of autoimmunity. And it goes from brain fog to skin diseases to everything that I had. I had 4 or 5 systems in my body that were being affected all at one time by gluten. It was scary. And the sad thing is that I'm not alone with this issue. And I hope you will also take the time to ask questions.
The other thing is, so when you can't figure out, when you have a patient who can't lose weight or certain things, just, they have multiple symptoms, why don't you let everyone know what you've been doing, what you found? Because this is.
Well, I tell them when all else fails, you go gluten-free, totally. You can't go halfway. It's a total picture. Margie's given me a nice little handout that I hand out to my patients and try to help them. What are some of the subtle places where you'll find gluten tucked into your food that you may not know? And they start them out with that. And I can tell you that I've seen people, Margie encouraged me to keep a list of patients, and I write little notes in my records on those people. And when I see them again, I said, how's it going? Some of the people say it didn't help. A good number of people have found improvements, and a couple said, it didn't help me much, but my husband is much better. So it's not the panacea for everybody, but it works for some. And I continue to spend the extra time to make sure that I tell them about
But
this.
what have you found? Bloating improved? The
Well,
people that improve, what
yeah,
improved?
so it wasn't all just autoimmune. The abdominal pain, their bloating, their constipation, their fatigue, their weight loss are obvious things. Their skin changes are better for some. Everything that can affect you with gluten are things that I've seen improve. But again, it is not itself the sole answer. It is one piece. And that's why, as you talk about digging deep, it's not just, oh, everyone's got gluten.
Oh,
It's
of
not,
course
it's
not.
just one piece of that big puzzle.
This was your story, but there are people the 3 most common ones that I see are gluten, dairy, and sugar that people really have. And some people have an issue with eggs. So there's something called an elimination diet that it's very inexpensive. All you do is eliminate. I'd like for people to eliminate. The 2 biggest ones I see are dairy and gluten. So I'll oftentimes have people eliminate both dairy and gluten for like 2 weeks, and completely though, 100%. And then eventually start and keep it, keep it like a food diary of exactly what they ate, how they feel. And it's amazing sometimes because people, you don't realize how much dairy and gluten is in your life. And then they add one of them back
Right.
at a time and see what happens. And what happens is when you've been off something and you add it back, it immediately. So it's certainly a way you can do the elimination diet. But I think the main reason that I really wanted you to share your story, and I can't thank you enough, because is that, again, the dig deeper, and that the autoimmunity is a cause of so many things. And I think it's people are paying more attention to it and paying attention to the root cause. But oftentimes with autoimmunity or inflammation, people will just give a medication,
Right.
and they think, okay, the person's feeling fine, so we don't have to bother with it. But it's so much better if you can get rid of the cause, and then the person can heal. So.
And just an aside, we found that in Italy, when every child gets into kindergarten, they test the entire population in kindergarten for gluten.
Yeah.
But they got pasta. I mean, they got serious stuff. They want to know what they're doing over there. So I thought that was fascinating that, we're not there, but there are places that have identified this as a real problem.
And another interesting thing is that 83% of the people who have celiac were undiagnosed or misdiagnosed. So it's something I think we could go on. And I am going to have a gluten specialist. I am going to have a podcast even delving deeper into this topic, because I think it's something that, a lot of people think, oh yeah, that person's just jumping on the bandwagon with gluten. Yeah. But the reality is it is very serious. And if you are a person that has this problem, and has antibodies or has any issues with gluten, it's life changing. You really need to take control of it and understand it, but then you feel great. So it's really quite amazing. So is there anything else that you want to share with the listeners?
I just wanted to give everyone, I wrote down a few points, just the things I think are really important for you. The first is, you live once, it's your life, and you cannot accept it when the doctors say, I don't know, or you're a medical mystery. That's number one. And if it's not in a medical text, it doesn't mean you're not sick. Those are really important. You're not insulting your doctor if you seek other opinions, be it either with traditional physicians or functional medicine or holistic providers. Sometimes you need to be the one who pushes things forward and when you dig deeper. And the last thing is, just because you went to see another doctor or practitioner to seek out an answer that you weren't getting, it does not mean your doctor is mad at you or angry or doesn't want to see you again. Oftentimes I'm like, thank you, because I didn't know. And it's a time for me to learn as well. So you have to be empowered to take care of yourself and your health. And if it's your loved ones or others, sometimes they can't see it, you can. So I really encourage you to be proactive in your health and seek out answers.
Thank you. And I really, really do appreciate you coming on and sharing, because we don't really like to relive it because it wasn't a very pleasant time. But, as I said, lessons have been learned. And I think between the two of us, we've helped so many people really, who have autoimmune issues due to gluten, and just even learn more about the gluten. But I'll include in the show notes the handout that you were referring to that I created, so that, because people don't know soy sauce has gluten.
Yeah.
There's a lot of things. It's not just not eating bread. There's more. But once you learn it, it's not that, and I think the population and restaurants, people are getting much more attuned to what's in gluten. And I think it's hopefully
coming.
Yeah.
It's coming, slowly but surely.
So
thank you for the opportunity to share my story.
Oh, well, thank you again for coming on. And I don't have to say, usually with my guests, I say, hope we keep in touch, but I don't have to say that to you.
Better not.
Thanks again.
All right, take care.
Okay.
Thank you, everybody.
I hope today's episode empowered you to always be proactive when it comes to your health. And if you were ever told, I'm sorry, there's nothing we can do, to dig deeper and seek out practitioners who are willing to work with you to find the root cause. In the show notes, I'll have a link to the Institute for Functional Medicine, and you can find functional medicine physicians throughout the country who look at the root cause approach when it comes to health. Also, I'll have links to the handout on gluten I mentioned, as well as Dr. Tom O'Brien's products that helped us so much. Anyway, bye for now, and look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.